Hi, this is Dr. Varisa Perlman with La Petite Creme, and this is another episode of our podcast, Beyond the Diaper, a place to talk about medical issues, but within the context of motherhood and self care. Our guest today is the wonderful nurse practitioner, Paige Williams-White,
Hello.
and she and I will discuss how to talk about rash. So let's talk about it. What's your feeling? When I say rash as a nurse practitioner, what do you think?
I think that this can go many different ways.
Yes.
I I would love to have responded and said fun, but honestly, rash can go so many different ways, and it's almost like so much there's detective work behind it,
Yes.
which is
Yes.
why it's not always the most fun. So I'm actually kind of
Yeah.
excited for this because maybe
Yeah.
we can make it fun.
Yes, absolutely. And I think that that is completely fair. And I think there has to be a systematic approach with something that can be very overwhelming. Because as you see when we talk about it, there are a lot of elements to the nature of the rash that when you characterize it, it helps the person who's listening to the story. Because when you present your symptoms to a doctor, to a healthcare provider, it is a story. And rash is one of those symptoms that really needs a story,
Yes.
right? So, one of the things that I like to preface before we start with rash is a priority. So, one of the priorities is understanding whether it's blanching or not blanching, right? So, petechiae is something that is burst blood vessels underneath the skin. Purpura is burst blood vessels underneath the skin. That is a very different that is a rash that requires emergency care. So when we say blanching or blanching, not blanching, if you have dots on the skin, when you press on it, what we'll ask is that do the dots go away and come back? But if the dots actually stay there, even after you press, and they're just there as if you weren't even applying any pressure,
Then we're
that means that
concerned.
those are blood vessels. So those are things that will require more emergent care and assessment. And now it could be that you scratched your skin really hard and you broke those blood vessels, but we like to kind of err on the side of caution because it could indicate a bacterial infection, something of a more serious nature. So before we talk about rash, that's one of the first things a healthcare provider will assess. Once we
Blanching
know that
versus
it's
non-blanching.
blanching, right? So the first thing you want to is blanching versus non-blanching. Once we've moved past that, now we can tell the story. Okay. So, one of the first questions is where is the rash?
It's
Okay.
all over the body. Is it generalized in one area? Things like
Yes.
that.
You want to, right? Is it like underneath the armpits, or is it in an area where the belt buckle,
Where there's been a lot
sits
of
on,
heat or moisture, things like
right?
that.
But, I think the best way to, so the first, I'm going to try to simplify it. So, the first thing is blanching or non blanching. The two is that is it generalized or local? Is that fair? That's
Yep,
it.
yep, fair.
Right? Right? Is
One,
it all
step
over
two.
the body? Yeah, step two, right? Three, right, is describe the nature of it. Okay. So people are like, what does that mean? Right? Are there little bumps? Right? Are there, is it a sandpaper rash where when you actually rub your hands over it, you can't see it, but you can feel it? Right?
The
Is it
color, the honey
crusting the
crusty.
color? Right? Is it crusty? Is it colored? Is it yellow or is it like red? Like so blanching or non-blanching, right? Tell me about the location, right? And then tell me about the nature
What does it
of
look
the
like?
rash, right? The fourth one is interesting because it's a little tricky. It's timing. So timing, did you have a fever and then you had the rash? Do you also have other symptoms along with
Cough,
the
runny
rash,
nose. What else is going on with it? Were you in a
right?
new location? Did you try a new detergent? Are we using a new
Yes.
lotion? There's so many questions
Yes.
that go into that timing thing.
Right. So timing and associated symptoms go together, right? So as we review, right, blanching or not blanching, location, quality, and timing, which includes associated symptoms. Is it something that within the context of I started eating this, and then half an hour later I had this rash. So timing and associated symptoms are the same. And then the last one is that what makes it better, what makes it worse. Okay.
I love this. I love this.
Yeah. It just, as a parent, you're literally like, you don't even know where to start. But as a healthcare provider, you can kind of organize the story so that when you pull the story in, the rash makes more sense. Right.
Exactly.
So let's go through it one more time. So the first is blanching or not blanching. What is the location? What is the nature of the rash? What is the timing or associated symptoms? And what makes it better or worse? And in those stories, it'll allow us to understand the relevance of that rash.
And figure out what to do next.
Right. Okay. So let's talk about some common rashes, right? So we're going to talk about viral rashes. We're going to talk about eczema, right? And then one that we know well with La Petite Creme is diaper rash. All right. So let's talk about viral rashes.
So
Yeah, go
those
ahead. Yeah.
okay. So those are the ones we're
Yeah.
looking a lot with what's associated with it, the fever, runny nose, cough, the timing of it. Did you want to go more in depth about the types, the more common types, the fifth
Yeah.
disease
Yeah.
versus
Yeah. Let's see
roseola
what you see.
versus
Yeah. Yeah.
um so definitely that fifth disease, that slap cheek, the
Hmm.
well slap cheek, red cheeks.
Yeah.
Again,
Yes.
that's something that comes with the virus. Roseola, did the
Yeah.
fever come before? And I've seen a lot of that as well, where they said, everything was fine. They had the fever, they were getting better, and all of a sudden I
Yes.
woke up and my child had this rash all over their body.
Yes.
And, to
Yes.
a parent, it can be very concerning. I've seen some where, it does look
Yes. And
concerning.
they're super cranky with that rash. So it's
Exactly.
really like they're like, this kid was actually calm with the fever. And then they got this rash. The fever was gone. So we thought we were done. And now
Exactly.
this kid is screaming bloody murder. And you're like, yeah, that's roseola. They're super cranky with it.
Exactly. So I don't know if you want to go more into,
One
there's,
more. Let's think about
okay,
one more viral rash. Yeah.
let's see, let's see.
Oh, well, let's do this. So that's viral. Those are kind of the two most common viral rashes. Let's talk about bacterial. So I'm thinking of strep.
Oh, yeah.
Scarlet fever,
Scarlet.
right? So
Yep.
that is a throat infection that triggers a rash. And sometimes I would see kids that didn't even have a sore throat and they would only have the rash. And that rash is a really sandpapery rash where you can't really like see it, but you can feel
Feel
it,
it.
right? And then I'm going to include in the bacterial little group impetigo.
That honey yellow
Impetigo,
crusted.
yes, yes. So impetigo is one of those situations where the skin, which is your largest immune organ, has been broken, right? Whether there's a cut or there's some scratching or a mosquito bite. And then what you do, unfortunately, when you scratch and you irritate it, is that any bacteria that's on the skin finds a party place, finds a home. And all of a sudden, this rash gets to be that crusty, red, irritated look. The thing that's annoying about impetigo is that it likes to travel,
Right.
right? So you'll have random clumps kind of throughout the body,
Hmm.
right? And a lot of times, which people don't always understand, especially in treatment, is that when you scratch and then kids will pick their nose, that nose becomes a great party place, right?
Oh,
So when
yes.
you treat it, right? So your practitioner might give you antibiotics, but also topical ones to decolonize the nose so that you don't have any kind of
Right.
leftover impetigo,
Right.
right? So, I think that's a good example of two virals. So roseola and phthis, right? And then the two bacterials that are most common are strep actually, and then impetigo and also strep that goes with this road. So those are like kind of good examples of ways that we're using context clues
Hmm.
to try to understand
Figure
the
out what it is.
relevance and nature of the rash,
Exactly. Exactly.
right? So let's talk about eczema, right?
Oh, this is a hot topic
So
going on these. No, this is really a hot topic. I
yeah, go
mean,
for it.
so I guess the reason why I say that is, you know, the world is very much shifting from the treatment that a lot of people have used for eczema in children. Eczema is really hard to watch in children, and I get it. It's very painful for a lot of. I've seen people in tears over it because it's such a difficult thing to treat at some points. And I know there's this big thing going on with steroids and usage in the children and, the long-term effects and things like that. And I'm almost in a place right now too where, I am searching deep and trying to find, are there ways to, avoid that? And are there more, I guess, what's the word I'm coming up with?
Like
Um,
more like holistic, I would
Holistic.
imagine is what,
Yeah,
yeah, right.
exactly. Just
Yeah.
more holistic treatments for it to maybe avoid those flare ups from happening where we absolutely have to use the steroid. Even
Yeah.
though I do feel like there is a place for it in cases. I've seen it
I
do
thought, right.
wonders, absolutely.
Yes.
But I
Yes.
do know, especially on the internet with a lot of moms, I've seen this huge uproar over the treatment of eczema.
Absolutely. So, my son who was an allergic kid. So, if you have a kid who has allergies in general, who has asthma, that's the triad. Eczema is that triad. So, you have a kid who tends to be allergic, right? Eczema is something that you're probably going to see at some point. It is the itch that rashes. I cannot emphasize that more because I have now a grown kid who is 20 years old dealing with a sudden outburst of eczema. And the problem is that when he's nervous or he's stressed, he scratches more. But if he literally tries hard to not scratch, it doesn't flare up as much. So it's the type of thing where, and I barely can handle this with a 20-year-old. Like when he's like in finals, which I just saw him, he was scratching like he was just like trapped in a cave, right? Like and just scratching away. I can't imagine when you have, and I've seen it with a 6-year-old, with a 3-year-old. It's very hard to tell them to not scratch, right? So finding things that bring down the inflammation are really important. Part of my issue, like you said, is that we're kind of in a state of flux because while there are elements of steroids that help bring it down, there is a little bit of a backlash because once you stop it, it can come back worse, right? And also, steroids will reach a point where they're not helpful anymore, right? So, we are seeing an emergence of a lot of biologics that are non steroidal, which can help bring down the itching. But I'll be honest with you, very similar to what you were saying in more of a holistic space, it's really important to try to figure out other ways to deal with the itchiness of it and to know what our triggers are. There is a bit of a pushback when it comes to different fields of medicine. So, a lot of dermatologists don't believe that there is a source to it. Okay. A lot of allergists will say that there is a source. Everyone's fighting, but what that does is that it leaves the patient in a weird limbo,
I think
right?
that's what's happening right now. And with a lot of
Yes.
parents, they're in this limbo of, okay, what do I do? And they are trying to outsource and do all the things they can at home and figuring out what is my child eating? Is, maybe if we back up on this, or
Hmm.
is there a stress that we're around constantly? Or, what am I using as my detergent? And everyone is moving backwards and really reevaluating the entire
Yeah.
situation, which I think can
Yes.
be a great thing.
Yes, yes. And it's a kind of thing where there's no reason why anything has to be linear when it comes to medicine. So having kind of a broad approach, I think there's nothing bad about that, right? It might be overwhelming and confusing, but I think it's much more overwhelming to feel like you have no resources, you have no choices, right? So let's take the idea of both treating once the rash occurs but also preventing the rash from worsening. Okay. So, in terms of treating, yes, we have steroids. Yes, we have antibiotic ointments because a lot of times with eczema,
And the
you break
itching.
the skin barrier and then it makes that patient more likely to have a bacterial superinfection on top of it. So a lot of times steroids and antibiotics are part of that. And then also your biologics are part of that. And that depends on the severity of the rash. But let's talk about what prevents it. This is the part that's more controversial, right? And this is the part where, as a practitioner, I lean into, but I don't always have all of the science behind it, right? So let's talk about, stress. Yeah, there's actually some studies showing that like certain stressful events can make the scratching worse. And again, as we understand, the more you scratch, the worse the rash gets. Okay, so let's all we're trying to do now is just prevent the scratching, right? Sometimes we do use things medication wise. We do use something like hydroxyzine, which is like, to try to kind of
Yeah.
decrease the scratching, especially. And I understand that.
Lotion.
Right, all kinds. So we'll talk about stress. Let's talk about environmental triggers. If a kid gets really sweaty, some kids, they get worse.
Hmm.
If they get cold or dry skin, they get worse. So being able to understand what triggers that on an environmental basis is relevant, right? I'm not I'm not putting all my eggs in these baskets, but
You're looking
but
at the
it's
whole
yeah,
situation. And
the
it's
whole
funny that
situation.
you just said that. I was in a class in my daughter's classroom, and one of her close friends, and these are 4 year olds. This is pre-K through 4 year olds. But one of them suffers has really big flare
Yeah,
ups of eczema. I personally did not struggle with eczema as a child, and now in
yeah.
my grown adult age, I'm having flare ups. And it's funny,
Oh,
my
yeah.
flare up started about 2 weeks ago. We're in Florida. Mine started about 2 weeks ago. And I'm talking to this mom, and she's like, yeah, we were doing okay. And 2 weeks ago, I started having this flare up. And I said, it's funny. I was just telling myself we had this huge drastic change in the weather. It's becoming way
Yes.
more humid out. And
Yes.
me and this mom, and she's actually a nurse as well. So we're
Yeah.
going back and forth, and that's why we
Yes.
ended up having this same conversation about eczema and how in school we learned
Yeah.
treat this is the treatment, this is what we do, and now
Yeah.
living in it, and she as her daughter, and me personally as an adult, we're really looking at the whole thing,
Mhm.
and just in that
Mhm.
one sentence, and really looking at, oh wow, same timing, weather changed around that time.
Mhm.
So it's interesting, and
Mhm.
again, there's no specific science behind it, but it is a thing to look at.
Yes. And people say, well, why is it necessary? Why would it be? What do you do with that information? And what you do with that information is that if you know that like humid weather does it, maybe you don't go out for as long, but maybe when you come in, you take a shower or you wipe down so that any of your crease areas are not as irritated or like wet, right?
Yep,
From
exactly.
sweat, and then you just decrease the
The
itchiness.
itching.
We're not trying to make big statements, and I think that's part of the give and take
Exactly.
with kind of, I would like to say, traditional medicine and kind of conventional medicine, is that sometimes conventional medicine wants like a definite that it's going to work on 100% of people. It doesn't work like that. Some people are, everyone's different, everyone's unique, but you need to take the time to figure yourself out and then obviously figure your kids out.
It almost goes into, when someone has, something going on with their body, we don't all have the same symptoms, right? Everyone, you may have different symptoms for this and that.
Hmm.
We're almost talking about just changing or decreasing the symptoms that come along with it. And
That's it.
what may work for, decreasing someone's symptoms may not work for the other, but also we're not
Yep.
all having the same symptoms. So I think
Yeah.
if you look at it that way, it helps. We're
It
not
does. It
so we're not
does.
curing it. We're just, okay, how can we decrease these symptoms and make you a little bit more comfortable, and
Yeah.
maybe, prevent the flare up from occurring.
Yeah. And this is something that takes investment from the parents, but also takes investment from the healthcare providers to be open to it. And what dealing with my son and treating with eczema, I found that the dermatologist was very much like, I'm just treating the symptoms. Like, I'm not trying to figure out where this is coming from. And I was like, yeah, but that's not the long game. Like, we can't keep just treating. I want as much of the eczema to go down as possible. And trying to figure out what triggers there are allows us to kind of get there before the itch, right? Because the itch goes with the rash. And that's the part that I think is very hard to always digest, you know? So we talked a little bit about um, uh, the environmental triggers, stress. The most controversial, I think, is food.
Yeah, I was waiting. I knew it was coming.
Food is the most controversial because we don't have really great ways to do the testing. And sometimes you can go along the allergist route. And I know that for my son, found that there was dust mite. So now he's in a dust kind of oral desensitization process. We're not so sure if it's helping the eczema or not. What I like to do, and I think this is the part that is a little bit tricky as a parent, because you also don't want to become like a paranoid person.
Exactly.
So I had an issue where I was having some stressful triggers, but I was ingesting, it sounds like a lot of chocolate. I know this sounds bizarre, you know, but eating a lot of chocolate, and that will actually, on a regular basis, and that will actually flare up my eczema, right? So I literally had a crazy, crazy eczema flare going through about a month. And then once I figured it out, I I stopped chocolate
Yeah.
and it got much better,
Yeah.
right? And so chocolate and me don't really work. I'll get pimples. Like, so for some reason, me and my skin and chocolate don't really work,
Yeah.
right? Um, Gluten, I can have it.
I've heard
It's not
that.
like I go anaphylactic, but if I am eating a lot of it, I will become very itchy. And especially it'll flare near my eyelids. So whenever we'd go to New York, we were visiting in from Miami, we'd come to New York and we'd be like eating pizza, pasta,
All the things.
bagels within 3 days. You know, it's like I was like, oh, I love New York. It's fantastic. It's and literally, you're like your eyes are bloodshot. Like, what is wrong with you? And I'm like,
It's
I
okay.
don't know.
It's okay.
Pizza. I'm not sure. I love it. Give me the pizza. Like, it was the stupidest thing in the world.
Yeah.
So I know that I can eat gluten, but the problem is that if I eat a lot of it and more regularly, my eczema will flare. Now, valid, not valid, something that can be proven on testing. Probably not. I don't know. Like, I haven't done the testing. But in the end of the day, any allergist will tell you that knowing you have a sensitivity is something that is only really, really proven if you by exposure. Like you get exposed to it, what happens, right? That being said, and I'm going to trick it up a little bit, is that sometimes it changes. Like for a while, you
Yeah.
might be sensitive to something, and then somewhere along the way, you eat a little bit of it, and it's not that bad. You can eat a little bit of it. So I think what's happening is that we have testing. We don't know what to make of it because there's IgG, there's IgE testing. There's, you know, does it mean that you should never touch it, or you can only have a little bit of it, or are you like anaphylactic to it, right? So like,
It's learning
boom,
to listen to your body. It's learning to, like you said, trial and error. Listen to your, okay, when I consumed this, let me make a mental note of what happened, or, when I did this, the time,
mhm.
things like that. It's literally just listening to your body and your response, and seeing and trying it out again the next time. Again, anaphylaxis, way different. but,
Yeah, we're not, yeah,
but,
yeah,
but,
yeah.
but in these cases, that's how I look at it. And for mine personally, for all the moms who are watching this, mine has only flared up postpartum. For some
Mm.
reason, after
Okay,
I
so
have a
that's
baby,
timing, right?
with the breastfeeding, and I only have it around those areas, like the breast areas,
Mm.
that's
Yep.
where and for me, I'm like, okay, is it a hormone? Is it the timing? Am I just more dehydrated and I need to be chugging more water and I'm making
So is
myself
it
dry?
only around where you're breastfeeding, right?
Absolutely. Yep.
So I think that you have a sensitivity to either saliva, right? Because the baby's saliva, or even just skin to skin. Like sometimes, like having people, like, you know, because the baby touches everywhere as they were breastfeeding. But that again is a good example of detective work, right? What's the timing? When does it occur? What's the circumstance in which it occurs?
Hmm.
So as this is, I talk about these topics for people to understand that it is a process. It is a process to understand, especially with a chronic issue like eczema. You know, we talked a lot about the acute questions, but for eczema, that's something that requires
It's a journey.
trial and error. And I mean, it's hard for us to do for ourselves, for our older children, but I mean, as a baby, How are we supposed to always understand that? So this is why it's very frustrating, and trying to get things under control is probably the priority, right? But at the same time, I'd like to believe that we're also trying to figure out what are some elements that we can pull from a kid to be able to see if it makes a difference, at least decrease some of the inflammation. To segue a little bit into La Petite Creme, one of the things I really like is the balm, because the balm does not have steroids in it, right? And these are very, natural elements. Now, some
Guess
people
who
do have
uses it?
sensitivities.
Guess
Yeah.
who uses it? Seriously, I've
And
been
I
using
love
it.
it. Yes. And the reason why I want to describe the way it works, the balm, with between like the olive oil, the beeswax, and the vitamin E, the reason why I really like it is because it decreases the inflammation. It's not a rash that goes away overnight. I'm not looking for magic. Everyone wants magic. Magic comes at a price. Steroids might take it away overnight, but there can be a rebound effect. So when I ask people when they use it on the eczema, and going back to the original thing that we talked about, I want the itchiness to go down. I want the redness and the angry to go down. That is the first step. And I feel like that is a more natural way for things to fade. Things don't go away immediately. We talked last time, fevers don't go away overnight. The idea is that things need to gradually go down. So, using this so that we don't escalate into a steroid or into an antibiotic is a nice first hand mark to be able to bring down the inflammation. So, to that end, when I start to feel I have a little spot of something, I have a little bit of irritation, I don't grab a steroid cream. I grab La Petite Creme, the balm, which is thicker because it has more beeswax, and I just slap it on there. And I just try to like kind of like go to sleep and not think
Yeah,
about it, right?
almost like this.
And
I put it
then
on and I do
yeah,
the
yeah,
full
don't scratch
disclosure
at it.
here. Full disclosure, and this is the truth on the truth. I love it.
Yeah,
And I really, after
yeah,
a while, when I stop and I'm like, okay, like I can go to sleep now. Like
yes,
I've decreased, and I'm not saying the next day it will happen again. It does.
yeah,
But I now know like I can grab that, and I do see the change in the rash. It's not that
yes,
red, inflamed,
yes. That's
bumpy.
all it is.
It's a lot. It's calmer. I love that
Calmer.
term. It's way more calm.
Right? It's calmer. And then it's not, and so, and what it does is that, I had this dad, he was at one of the Prego expos, and he had like a lot of eczema on his neck, and I was like, oh, and he's like, can I use it on myself? I love the dads, but they're always like, how does this benefit me? And I'm like, we're really here for your baby. It is called Prego Expo, but okay, let's bring you into the fold, right? He
Come
said,
on
how does it
in.
help me? Yeah. And so he was like, how does this help? And so I said, let me ask you, are you coming to the next day? Like, it's a Saturday, Sunday event. He's like, I am. I said, I'm going to put the balm on your
Oh my
skin.
gosh, I
So
love
if you
you.
walked by, you'd be like,
Oh,
what the hell is she doing? And here I am, like, kind of lathering
lathering
his neck,
beside her.
right? Right. And I'm like, okay, I'll see you tomorrow. And he's like, good. It was like kind of really strange. And so he comes back the next day, and he's like, I could sleep last night. Like, it doesn't, and it was still red, and but it just wasn't as angry. And he was just like, oh, like it was stinging, it was hurting. And the thing that I like about La Petite Creme, the balm, is that when you put it on areas that are raw,
Mhm.
it doesn't sting, right? It does.
It
Sometimes even
doesn't.
hydrocortisone actually
Yep.
stings once you put it on, and this actually soothes. It's very calming. So I really want to kind of throw that out there for people with eczema to consider it. Um, I really like so going on to diaper rash, right? Which just is, again, why would you get diaper rash? You get diaper rash because of the location. You've got area that's not being aired
Humidity.
out,
Yeah.
all the moisture, right? Um, and it's usually sometimes there's even irritation from the diaper itself, which is not great, right? So diaper rash is something that should happen actually, because it's just not an area that's being well taken care of.
Yeah.
So you've got, all the irritants like the pee, the poop, the sweat. And
Especially the
so in many
poop.
ways, the poop, yeah. And I mean, it's that kind of thing where, you just, what comes out in the poop might be like some acid because it's saliva that's coming through sometimes because they're teething so much, loose stools, whatever foods. So in that situation, being able to know that every time that you take La Petite Creme on a cloth or on a cotton wipe, you put it on, you've wiped off all of the debris, but now when you close it, it's not just like dry skin. It's just literally like protected
Barrier.
beeswax,
Yep.
vitamin E, olive oil barrier. And I love a barrier. I'm someone who wants to protect that skin, right? I'm obsessed with it. And when you put on the gloppy Desitin and you put on the gloppy kind of thick
Yeah.
things,
The butt
it
paste.
doesn't necessarily mean it does a better job at it being a barrier. It's can be a bit of an irritant.
As a matter of fact, in the NICU. So I personally, okay, this is going to sound crazy. I get excited with diaper rash because I love to see the healing process. Weird, I know, very strange,
Yeah.
but it's almost like I love to see the way that the barriers and protectors and the things that you do really just help that skin do what it does and,
Yeah.
protect us.
Yeah. Yeah.
When I would get floated to the NICU as a nurse, we mixed. We would make our own
Hmm.
mixes of things. It wasn't just, okay, let's put on that Desitin or what
Yeah.
is it, the
Yeah.
butt
Yeah.
paste or the this. We did use that, but we used a mixture of things because we realized that, yeah, you're putting that there, but where's the nice, seal underneath that good
Hmm.
I wish I can remember the name of what we would use. It's going to come to me. And only the
But
NICU had it, but it worked
yeah.
as like just the seal before we would
Yeah.
even put on the
But
Desitin
that.
and the cakey
Yes.
stuff.
Yes. Well, we had spoke to Alyssa, who was a NICU nurse, who is a NICU nurse, and she was describing the fact that the skin is so fragile on these, especially these micropemies, but even just the little babies, that you don't want to be coming in multiple times. So one of the things that's good with La Petite Creme is that you can just wipe and then you can close. You don't need to come in again. You don't need to touch that skin again. And the less you touch that skin, the less likely it's going to break down.
Exactly.
And I believe that that goes for anybody's skin, honestly. So being able to kind of have that barrier and reinforce that skin immune organ, which can really help you decrease bacterial infections, fungal infections from overgrowing, right? And then closing the diaper, it really takes some of the guesswork it out of it and actually just brings your routine into prevention versus only treatment.
Prevention is the
And
biggest part of, for me,
yes.
and again, this might be,
Yeah.
raised by immigrant parents thing, but
Yes.
prevention is a huge thing when it comes to that diaper rash. My mom, if she's sitting here watching me change my baby's diaper, if she does not see me putting something, there's no rash, there's nothing
Yes.
there. But if I'm not
Yeah.
putting something there for each change,
Yeah.
she's, whoa, whoa, wait, you forgot, you know?
Yes. Well,
Because,
that's because yes. Yes. I mean, I think that there's part of like the kind of like third world idea that like we don't have all the bells and whistles all the time. We don't have the fancy medicine. So why don't we try to find out ways to not even get to it? An ounce of prevention is worth a pound of cure. And
oh, I
in
love
many ways, right? Yeah, it's a really good I think it's a Chinese medicine saying. It's a very, very simple saying, but I think it really illustrates the difference between kind of conventional and traditional medicine. I feel like so much of conventional medicine is like we only really pay attention when we have to treat it. We're not trying to prevent it. So in many ways, being able to be ahead of the game versus behind it, ahead of the eight ball versus behind it, you really want to be sure that with your kids, because I feel like, especially as they get older, they don't give you many moments to look at their skin. They
yeah.
don't give you many moments to like check them. So when you see things, unless you're kind of going over their body at least once or twice a day, you could miss a rash,
Yeah.
you could miss a little bit of a cut, you can miss things, right, that could be really getting worse. And so I love the idea of like not only preventing it, but also the minute you see it, grabbing something that's not a steroid, grabbing something
Yep.
to kind of
That's
bring down
exactly what we
some of
do.
the inflammation before we get to the point where we need to see a doctor for an antibiotic or a steroidal.
And it does
Um,
continue even outside of, the infant stage or the baby stage. I have my 6-year-old who when you would treat her, this was an issue back then too. Her areas are
Yes.
constantly still getting red. I don't know. She's just way more, well, she definitely retains more moisture in those areas.
Mm-hmm.
And I still to this day have these issues with her. She's going to be 7 this year. And especially in the
Yeah.
hot summer months, she's coming to me and she's telling me, Mommy, it's hurting down there. It's hurting. And I look and some
Okay.
days it's bright red. Um, the reason why it's getting tricky, and it's funny that you mentioned this, and maybe you can even speak to this with
I'm gonna
your
tell you
adult
now.
children.
Yes, yes,
She's getting
yeah,
older, and we just hit this stage of she's showering on her own. She's
yeah,
oh, it's fine. I can bathe myself. I could do this, and I want to give her that independency. But I'm also missing out on the daily checks I used to be able to do, and now I'm
yes,
waiting until she's telling me, oh, there's something going on, and I'm, oh my goodness, it's red. Things like that.
yes. So
So you can
let's put
help.
our detective hat on, right? I'm going to give you 3 different scenarios why her area can be getting red. Okay. So let's start with the showers. All right. So soap is an irritant. So when she puts soap in that area, unless she is really, really careful, she is not going to be able to get all the soap out. She has to be really, so I almost hesitate to put a lot of soap. Sometimes I ask everyone to use a bar soap as opposed to like a pumpy soap because the bar soap can just like kind of minimize the amount of soap she's using. And even if she puts soap there, she has to really rinse it out. Definitely no bubble baths by any means. She should never take bubble baths, right? And then, when she kind of rinses, or don't even do a lot of soap in there, right? Because that's an area that, again, water would just be fine, right? But when she puts soap in there, they don't realize how much of an irritant that could be, right? 2, my sweaters. I'm a sweater. My parents are from Thailand. I'm made to sweat, right?
He
So
is a sweater.
yeah. So, underwear, right? Like if she's just kind of sweating in there, even her shorts, any crease areas, in the morning, it doesn't hurt to have her do a couple of wipes where she puts it on toilet paper and she wipes with La Petite Creme because that leaves a little bit of barrier, right? And whenever she comes in from being outside, I don't know how I literally had to do a wipe down. So I took a cloth and I literally like wipe down, with some water and wipe down all my creases and all my areas. And I put on a fresh pair of underwear, honestly. You just kind of have to refresh yourself because you know that your skin is irritated if it sweats too much. You can also put the La Petite Creme in the creases, either as the lotion or the balm, because those are the areas that tend to retain the moisture the most. But like if you've been sweating outside, when you come in, you've got to refresh your whole body. Don't have to take a whole shower, but just taking like a wet washcloth and wiping down everything, much better. Okay. Really important. And the last thing again is just wiping in general. Wiping in general can be a really tough thing besides the fact of direction, right? Making sure they're going from front to back, no back to front. But it can be a lot. Sometimes I'll just say, if you can't reach, because if you actually watch them, a lot of times they can't reach, going going from the front and maybe patting and dropping is a way to try to kind of get things done. But if you put a little bit of lapis creme, you know that there's at least a barrier that has been left there. So that as she wipes in the future, it's not going to necessarily be as irritated. And whatever is irritated starts to go down because it's been cleaned. But there's also, the vitamin E and whatnot to kind of like bring down some of the inflammation. And so that's a good example of using detectiveness to do it. Well, thank you so much for being here. This is a great time for us to kind of like figure out all of the different ways that rash can exist. And we'll join you again. Thank you. Bye.